Welcome to the Besties with Breasties podcast. Sarah Hall here. I am a certified health and wellness coach, athletic trainer, mom, and breast cancer survivor. I help women overcome their own mind drama to make mind shifts that open up the possibility for their most empowered and energetic life.
And I am Beth Wilmus, author, speaker, and founder of a human investment organization, otherwise known as a nonprofit, called Faith Through Fire. Our mission is to reduce the fear and anxiety that breast cancer patients feel and replace it with hope and a path toward thriving.
This podcast is about our experiences with breast cancer
and life after as young survivors and moms. All right. Hey, Sarah.
Hello.
Hey, Heather Burns. How are you?
Hi, I'm good. How are you all?
Good. We're excited today, guys. We've got Heather Burns with us. She's a licensed master social worker and the program and outreach director for Gateway to Hope, which is a nonprofit here in St. Louis. Prior to joining Gateway to Hope, Heather worked with adults battling chronic and terminal disease. So welcome, Heather. We're excited to have you today.
Yeah.
Thank you so much. I'm excited to be here.
So we're going to kind of start off. We like to keep the mood light. We're going to start off with a couple of icebreaker questions. So you guys, I want to ask you, what season do you like the best?
Oh, for me, this is easy. Heather, what season do you like best?
I'm a fall girl.
Oh,
really?
Why is that?
So I'm a big fan of Halloween, kind of to the point where it's obnoxious. So, and I view Halloween as almost like the kickoff to the holiday season. So, just the temperature drops and one day it might be 80 degrees and, at night it's 50 and I don't know, it gives me all the good vibes and I just love it.
Nice. Yeah. What about you, Beth?
I'm a summer girl.
Summer? And why is that?
I don't know. It's just because I love the sun.
Uh-huh.
I love the heat.
Mm-hmm.
I love being outdoors.
Mm.
So, and we spend a lot of time on the lake with our boat. So the hotter, the better, because then the water just feels that much more amazing. So yeah, I'm a summer girl. What about you?
Same, summer. I love tank tops. I love dresses. I think you only have so many choices in the winter. And
it's a fashion choice for you.
Yeah, maybe it's a fashion choice, but it's also I don't know. I just love to do all the summer activities. Yeah. Being outside, being in the water, being in the sun on my skin feels really good. Yeah. I'm definitely
my sister-in-law absolutely detests the heat.
Really?
Detests the heat. We did a family experiment inviting her to go camping with us once, and it was an epic fail.
That's why it's an experiment.
Right, exactly. All right, cool. Yeah. I like that question.
Okay, so Heather, Beth and I were talking about this question before we got on here, so I'm really curious to hear your answer first. But do you collect anything?
Oh, man. So I go through phases of collecting things. I know that sounds weird. At different points in my life, I don't know, at one point I was really big into Marilyn Monroe memorabilia type stuff. So I collected a bunch of things like that. And then I went through this kind of weird Tinkerbell phase. And so I collected a bunch of that, and I have since stopped collecting those things. But I think right now one of the things that I'm into is vintage furniture.
Oh, interesting.
Yeah,
I could get behind that. I love some resale shopping.
Yes. So I'm kind of getting into that, and I'm actually we're moving here in a couple of months, and I'm redoing a 1940s Art Deco bedroom set.
Oh.
For a new room. So that's kind of my thing right now. That's tough. But I go through phases where I collect random things I don't really need, but trying to not do that, especially with moving coming soon, because goodness, 4 people should not have as many items as we do in this house. So that's changing.
Sarah and I were feeling boring because neither one of us collect anything. And we were just saying, we were wondering what that says about us. Are we not interesting enough to collect things? And so we've decided you're more interesting than we are. So
No, I don't.
I mean, I think I could go out on a limb here and say you collect sweaters.
Man, you're such a hater on
Call out.
Such a hater.
Yeah.
Actually, the other day I was looking at one online and Gary goes, "Are you actually going to buy another sweater. So,
Yeah.
okay, I may collect sweaters. Never mind.
Yeah, I think there's like a rule. If you have more than like 3 of something, that's technically a collection, right?
Oh, well, there you go. Now we have a rule to it.
Well, then we know it's true. All right, so let's talk about what we're going to be talking about today. Financial stress during a cancer diagnosis.
Yep, that's real.
Right. And then that's why Heather is here today to talk to us about Gateway to Hope and how they help eliminate barriers to care so patients can focus on healing. And then maybe what patients need to know regarding how to get help. So before we get into that, let's hear from our first sponsor. Hair loss is consistently ranked as one of the most feared side effects of chemotherapy treatment. The emotional impact chemo hair loss can have on patients has been well documented. Scalp cooling is a simple treatment that can prevent hair loss caused by certain chemotherapy drugs. The use of scalp cooling is proven to be effective in preventing chemotherapy-induced alopecia and can result in people retaining much of their hair. Paxman is the global leader in scalp cooling. Their cold cap is scientifically proven to reduce hair loss during chemotherapy. If you are facing cancer treatment and concerned about losing your hair, ask your provider about scalp cooling and visit our website at paxmanscalpcooling.com. That's paxmanscalpcooling.com.
All right, and we are back from our sponsor, and we are with Heather Burns today, who is here to talk to us about financial stress during diagnosis. So Heather, tell us about what Gateway to Hope is and what's the mission?
Yeah. So Gateway to Hope, we are a nonprofit founded about 15 years ago by 2 surgeons in the St. Louis area. So Dr. David Kaplan and Dr. Marlis Shu. David Kaplan's a plastic surgeon and Marlis is a breast surgeon. And so, like I said, 15 years ago or so, they identified a need for breast cancer treatment services and reconstruction services for individuals who were uninsured and had a breast cancer diagnosis. So they networked with their colleagues in the St. Louis area, partnered with local treatment facilities, surgeons, everything from diagnostics to reconstruction, so that essentially they could provide every aspect of care at no cost for women who were uninsured. So that was how the organization started, again, 15 years ago. Fast forward several years after, making a huge difference in quite a few women's lives through their breast cancer journey. And again, coordinating every little aspect of care from chemotherapy to radiation, again, to reconstruction. The Affordable Care Act passed. And at that time, the thought was that this will give more people access to health insurance, right? Which
the
it
idea,
did.
Yeah,
that was the idea. So to an extent, it did. So the program model changed a little bit from a donated care model to more of a financial assistance model, because as you both are keenly aware, the cancer diagnosis and just the time off work and everything in between, medical bills, just the follow-up appointments, the co-pays, the prescriptions, it is incredibly expensive for somebody with this with a breast cancer diagnosis. So the organization moved to a financial assistance model, so providing payments for basic living expenses, so things like rent, mortgage, utilities, any transportation costs, so car repairs, car insurance, car payments, and then also providing assistance towards health insurance premiums so that anybody who was struggling to maintain their existing coverage would not have that be a barrier for them to receive life-saving care.
Got it.
Yeah, so that was where the model shifted to, and that's how we're operating today in a little bit of a different form. The big emphasis, in addition to the financial assistance, is also our navigation services. So our program is comprised of social workers, and the navigation support that we provide is a little different than what someone may experience from a navigator in the hospital. So again, we're social workers. Usually the navigators in the hospital are nurses. So just a little more of a medical, clinical focus on the hospital side of things. And our focus is more psychosocial. So working to, make sure that the individual who we are working with has all of their needs met to the best of our abilities during their treatment journey. So making sure they feel emotionally supported, connecting them with mental health resources if it's something beyond what we can support. If there's specific assistance that they are needing for their children, connecting them with local or national organizations to get those needs met as well. So just giving them a very individualized experience as they work with us. On average, we work with patients about 5 to 6 months. And
because I think people maybe don't recognize how long the breast cancer treatment journey is. I mean, it's basically at least, anywhere from
at the very minimum a year.
Right. 6 months to a year is the 6 months that you're referencing is kind of the thick of it.
Yeah.
Like when things are really overwhelming and just you're getting piled on with every single treatment and appointments and everything.
Surgery.
So it's a long journey. It's the same thing with our mentorship program. I mean, we're usually with these women for a year because it's not just a one and done thing.
Yeah.
So sorry, Heather, I didn't mean to interrupt you. I just wanted to kind of
no, you're fine.
Give some context.
It's so true. And I think a lot of people don't realize that, right? They think, oh, once you're done with treatment, you're done. And it's much, much more.
And it's even if are women going to get treatment if they don't have that, if their psychosocial needs aren't being met? And the answer is often no. They're worried if they get a breast cancer diagnosis, their first thought is not always necessarily, am I going to die? It's how am I going to get to treatment? How am I going to afford to have treatment? How am I going to make my rent and pay my medical bills? And so that's a very real problem for a lot of patients out there. And so I think it's good for people to know that, being diagnosed with a life-threatening disease is terrifying and very, very emotional. But often for people, it's not their first concern. And that's what people don't realize. So you deal with this every single day. And I'd be really interested in kind of talking about what a typical scenario is for a patient that you help. But before we get to that, do we want to maybe do boobs in the news?
Yeah.
Do you want to do boobs?
Yeah.
Heather, you want to do boobs in the news with us?
Yeah, absolutely.
Sweet.
Okay.
Boobs in the News is a fun segment where we read funny tweets from real people or ridiculous news stories.
Boobs in the news, boobs in the news, boobs in the news.
I'm laying this one on you today.
Okay.
Okay.
Go ahead. I'm
Are you
excited.
ready?
Yeah, I'm ready.
Okay. A woman in St. Paul, Minnesota, she has been collecting. Wow, we come full circle with that one there. She has been collecting used Band-Aids for 10 years.
Oh.
She uses them in her mandala wall hangings.
What?
Yeah.
First of all, what's a mandala?
It's like that. They're usually like a circle. They, you can buy like a rug or a towel or a wall hanging, but they're a circle and they're usually kind of like, I don't know how to describe it.
That is so gross.
Yes, pretty gross. And she prefers Band-Aids with traces of blood and other fluids on them. What?
That is so gross.
She
Really
actually
good.
stops random people if she sees a Band-Aid on them that she wants. They
I'm
usually
sorry.
give her strange looks.
Nope. I'm throwing the mental health card here. Heather, do you want to, as a social worker, does this veer into the mental health field? I'm saying yes.
So
I don't think I can speak on that without meeting this woman and doing a full assessment.
Oh, look at her. She's a total professional. I need not meet this woman to diagnose her.
So you guys, though, the women's Band-Aid wall hangings have been displayed at the University of St. Thomas and the Museum of Arts and Design in New York.
What?
So these are like legit.
What?
Somebody recognizes this as art. The works represent sickness and healing.
What? Okay, people, weigh in. This is controversial. This is our first controversial boobs in the news. I want to know. I'm going to post this on the social account. Is this art or is this just gross?
Maybe this is our judgment because we don't collect anything. We are judging this poor woman because she collects Band-Aids.
Used Band-Aids, Sarah. Used
Okay, fine.
Band-Aids. Oh my gosh. Look at Heather. Heather's being all PC. She's like, I'm not judging this woman. I have not met her. I have not assessed her. Yeah. And see, Heather would probably be the smart move here because other people are displaying her work. So,
Yeah.
Oh my gosh. I'm claiming that's a boob.
Totally.
All right. That was our boobs in the news.
Boobs in the news, boobs in the news, boobs in the news.
So we're back. Heather, can you kind of tell us what a typical patient might look like that comes to Gateway to Hope? What's a typical scenario?
We see all walks of life. I mean, as you all know, breast cancer does not discriminate when it comes to age, when it comes to race, even in gender. We've had some men who have come through our program in the last couple of years. So we really see just all different kinds of scenarios. I think that a typical patient is somebody who is just going through the motions, right? So they're experiencing distress because of their diagnosis. It varies depending on when somebody comes to us during their journey. So we are seeing patients more often in the earlier parts, so when they're newly diagnosed. And there's definitely a whole lot of different things to work through the earlier on in the diagnosis, just because it's so fresh and so new. But our eligibility criteria, there's no age requirement, again, no gender, no citizenship, nothing like that is required. There is a financial requirement, and it's basically the household income cannot be above 450% of the federal poverty level, which I can tell you exactly what that is because it's changing often. For a family of 4, that would be like $120,000 a year approximately. So the household income would need to be less than that for a family of 4.
Mm-hmm. So that encompasses a lot of people.
Yeah.
I mean, that's a lot of people that are eligible for help, right?
Right. Yeah. It doesn't matter. I have seen individuals who have had their finances like completely buttoned up and together, right? Like that's not me. But there are so many people who have made just really wise financial decisions and contributions to different accounts and things like that. And, when this diagnosis comes along, like you're looking at, easily $20,000 in medical debt, depending on your coverage and, the treatment duration and all of those things. So every little bit helps. And as we were mentioning earlier, financial toxicity, I mean, that has so many adverse effects on treatment outcomes. So that can contribute to somebody skipping meds or skipping appointments or not following their treatment protocols. And that can be the difference between an advanced stage diagnosis, which could, essentially mean life or death. And it shouldn't have to be that way. So
yeah. I think a lot of people are out there thinking, okay, can I afford to get breast cancer treatment? But when they forego or they delay breast cancer treatment, what ends up happening is that they need more help, more services, more treatments, to your point, if they're later in their diagnosis. And then that just, compounds the financial burden. So I think it's really important for people to understand that if you're worried about finances, that you need to reach out to an organization like Gateway to Hope because they can help you minimize that impact and prevent it from spiraling out of control by ignoring it, and you need to get healthy as fast as possible. And I think that that's the unintended consequence of kind of ignoring it or thinking that you can't afford it is that you may end up paying more down the road, whether you want to or not. So I think that's incredibly important.
It's also important to know that sometimes giving yourself the space, like it can be hard for some people. I've heard it from people that I've mentored that it can be hard to ask for help or to say that you need help, but sometimes giving yourself the space to have chemo and not go to work, to be able to heal and not put that burden upon yourself to do everything while you're going through treatment. And all it takes is actually just being able to ask for help.
Yeah,
because these organizations are out there.
I mean, I've heard it multiple times. I'm sure you have too. Is there's people who probably need it more than me. Is something I hear often. I don't want to ask for help because there's people that have it worse, or that I don't want to take it away from somebody who might need it more. And it's like, no, you need this. Yeah, and it's okay that you need this, and it's okay to accept it. And
so, survivor's guilt is a real thing.
Right. Which I'm sure we'll get to at some point in this podcast. Interesting.
I would really like to hear what Heather has to say about her biggest challenges that they face.
Oh, as an organization?
Yeah. Like, I mean, is the biggest challenge just getting people to come and actually utilize you, or is it? Do
they know about you? Is it very? Are they easily able to find you? What do you guys face as an organization? What's your biggest frustration?
I think some of our biggest challenges are, so we serve the whole state of Missouri and in Southern Illinois. So, and I think a lot of our reach has been concentrated in the St. Louis area. Mostly, we're small. And we do have connections with other healthcare facilities in rural parts of Missouri and, in the Kansas City area and in the Southern Illinois area as well. I think the biggest thing that is challenging for us is just expanding our reach. So, and even in the St. Louis region. So specifically in St. Louis County, Black women are twice as likely to die from their breast cancer diagnosis than white women. And that is something that we are really passionate about changing as an organization. And there's lots of levels and layers to that, like lack of health insurance and access to care and just healthcare equity in general. So that information right there tells us that, we need to be really intentional about some of our outreach efforts, especially when working with communities of color, to where they are aware of our services. One thing that we will be doing a little differently this year, so in addition to the financial assistance and navigation assistance for individuals who have a breast cancer diagnosis, we'll now be providing navigation support to individuals who are looking to just get a routine screening, whether it be because they discovered something in a self-exam or they were referred by their primary care provider. Those people can now call us and we can help them locate a mammography site that's maybe close to their job or has flexible hours or what have you.
Yeah, because I think it's been kind of established, right? Like prevention is key, right? We want to prevent it from ever getting to the point where you've developed a breast cancer and have waited too long. And so I think that's a critical piece, especially when you're talking about this health equity and making sure that women of color, have access to those services so that they can, have peace of mind and make sure they're getting proper medical care.
It's a useful service, I think, because people will put off something that's a little bit scary, and
or expensive.
I've had two people, and I've had two people contact me being like, "I found this. What should I do?" Like, well, you know what to do, like, and maybe costs is stopping them from going, or maybe it's any of the things that you just mentioned, like maybe they don't trust the medical system, or they just don't have.
It's layered.
The finance. Yeah, it's very, very, very layered. But that's a great service that you guys are offering.
Yeah. And the pandemic has just exacerbated things, right? Like screening locations were closed for 6 to 8 weeks nationally. So there was a pretty big drop in just overall screenings in general, but specifically relating to breast health and breast cancer. So we recognize that, and we've been communicating really closely with providers locally about what that means in terms of advanced stage breast cancer and just, what we can do to help women and any other individual who feels like they need a screening. Like, what can we do to help support that, right? Because prevention, like you just said, is key. And breast cancer doesn't have to be a death sentence. It's definitely treatable. There's new treatment options rolling out. I mean, it seems like every day. I know that's exaggeration, but
the changes just from the time that I went through treatment 4 years ago to today is completely different. Like, there's so many different things.
Yeah. So, and that's really hopeful, right? Like, because more than likely, if the cancer is detected early enough and treatment protocols are followed and all of those things, then, this could be something that is just a small blip in somebody's life versus, a defining moment.
Well, and I think that's why it's so awesome that you guys are focused on the psychosocial support as well as the preventative with the mammograms, because, I mean, Sarah and I talk about this all the time, but chances are you're going to enter into survivorship and be okay. And so you need to pay attention to those other aspects of your life. It's not just the cancer diagnosis. It's also your emotional and your mental and your, physical well-being and your practical support. So I think that's filling a critical need for sure.
Thank you. Yeah. And we, that aspect of our program continues to evolve and grow. And I'm super excited to be a part of that, as a social worker, and just having worked with individuals who are going through like healthcare crises. I know what it's like. And just from a personal standpoint too, like, I don't know if I've ever shared this with you, Beth, but my aunt is a breast cancer thriver. So she's living with stage 4 breast cancer. And I've been a part of her journey and her support system. And I can't imagine like what it would look like to not have the support that she has been so fortunate to have with friends and family and meals and, you know, different organizations. And so it just gives me a whole nother like sense of determination, because I know there's women out there who don't have that level of support. And so it really helps me, you know, take that experience and just fine tune what we're doing at Gateway to Hope to make sure that every woman, every man, every person that we serve has, you know, feels as supported as my aunt has felt in her journey. So.
Yeah, we all function a lot better when we are kind of driven by our own internal like pull to serve something that's greater that we have been personally affected by. So thank you for sharing that. Before we conclude for today, let's hear from our second sponsor.
SSM Health is a proud sponsor of the Besties with Breasties podcast. 1 in 8 women will be diagnosed with breast cancer during their lifetime. Early detection is key, and keeping up to date on yearly mammograms could be life-saving. At SSM Health, we offer patients in the St. Louis area online scheduling for mammograms, including next-day appointments. Visit ssmhealth.com/schedule-mam to make your appointment now.
Okay, and we're back. So Heather, tell us about how patients can find you.
Sure. So a few different ways. Like, we are totally flexible. We're getting with the times. Patients can text us. They can call our direct line or text our direct line, which is 314-569-1113. Again, that number has text message capabilities. Upon contacting us, we will get them established, get an application out to them, work with them through that process. You know, typical turnaround from start to finish as far as when somebody contacts us. I mean, I would say within 48 business hours, we are following up with anybody who reaches out. So we also have a website where our application can be found there, and individuals can email us through our website as well. And that is www.gthstl.org. And then one of our patient navigators, Sarah or Megan, will connect with that interested individual and we'll get them set up. But it's not a difficult process. We try to keep it as simple as possible, because we know that when you have a breast cancer diagnosis, like, you have enough going on, and we don't want to complicate anything. So we try to keep things as simple as possible. Like I said, text messaging is a thing. Like, you know, that's for a lot of our younger patients, that's their preference, right? The only form
I love me some text messaging. I'm all about the text.
Don't leave a voicemail, send me a text.
Right. Well, thank you so much for being with us today, Heather. The work you do is amazing, and we really appreciate what Gateway to Hope is doing for breast cancer patients.
Yeah, absolutely. It's been a pleasure to talk to you.
Thank you so much for having me. I appreciate the opportunity.
Of course. So today we've talked about Gateway to Hope's mission to remove barriers to affordable, timely, quality healthcare. And next time we're going to continue our discussion regarding finances when we talk to another nonprofit whose mission is to promote economic success by providing financial education and access to reliable financial products and services.
So until next time, guys.
See ya.